Come on in. Hi, I'm Dr. Gina Beasley. I'm the owner and director of All Ages Vision Care, and I welcome you to our office. I would like to give you a quick tour and show you what you would expect when you come to our amazing facility. We have 4,500 square feet dedicated to vision enhancement and vision therapy for all ages, hence the name All Ages Vision Care. So if you look this way, is our comfortable waiting area, and we also have a optical that is for specialty glasses that we use to treat vision related problems such as concussion and head trauma, as well as eye tracking for kids that are in elementary school that are having challenges with that. Here's our front desk. Our patient care coordinator would check you in and let you know about scheduling and payments and that sort of thing. That is handled here at our reception area. Come in, I'll show you in here. When you first come and check in, we do some pre-testing. In this room, we have state-of-the-art electronic equipment for visual field testing, for eye pressure testing, and some other specialized testing in this room. So follow me down the hallway and I'll show you the other areas that you would be seeing. You see we've got a lot of graduate pictures here on the walls, and we'll walk on down this hallway. This is one of our newest exam rooms. I'll invite you in here to the primary exam room. And this room is quite a bit longer, as you can see, than a standard smaller exam room that you might see in most eye doctors' offices now. The longer room gives us more accurate readings for pediatric purposes because they're looking far in real space for a far test. When you're in a very small room, children tend to focus and accommodate for that particular length of the room. So a longer room will give us more accurate readings for measurements for glasses. Okay. This room we do some specialized testing, and most of the areas in our office are very child and parent friendly, meaning we all have open access. So even if we were to close this room to make it more private, you can see there's a big window here so we can see exactly, if you're a parent, you want to see exactly what your child's doing. And this big room here is our most active room. It's the area where vision therapy happens and vision rehab. And we recently expanded to that other space over there. Our original space was, as you can see, where the carpet ends. We've added some private rooms to the end down there for specifically head trauma and younger children that need more private, less stimulus bound, like a big room. The big room here is more for to simulate a classroom setting or a sports event setting where you've got a lot of things, a lot of people talking, a lot of action going on, so you can learn to divide your attention and still stay focused on what you need to do. But if we have a person that needs restricted lighting or less stimulus than this big room provides, we also have that capability now. We've been using that for almost a year now. That was done last fall. So we're very pleased to offer state-of-the-art vision therapy, and I can show you a few of the tools that we use for that. If you follow me in here, this is our sports vision integrator. It is like a huge iPad in function. There's a touch screen, and then we can touch certain colors as we're going. So right now the pattern's red, white, and blue. So I got to hit a red one, and then a white one, and then a blue one. If I go out of order, then I don't get credit for it. And this can be adjusted for young kids all the way up to our athletes that are in high school, college. As you can see, there's a lot of space. We do a lot of free space activities which are the most natural for using your visual system. We also have independent stations for each person where they call home when they come and they start working with their therapist one-on-one. And we do some things seated at a desk and some things that are up and active. We do a lot of very high active therapy activities. More of our balance and sports are related over on the rubber board, which was the new addition. It's like a rubber sports board, which has a little better traction than carpet does if we're doing some eye-hand coordination or balance and agility training. This room here, we call it our dark room, and it has a projector which projects a large picture all the way on the wall here, which is working on teaching 3D viewing to people that have had either eye teaming problem, like let's say their eyes crossed when they were a baby and they never developed 3D vision. We can help develop that in this room by making the target so big that they can get a grasp of the idea. We also work in this room with our head trauma patients. There are some neuro visual rehab components to that computer program. And it's also an isolated room if we need to do some balance or bilateral integration work. So we're very happy to have all of these specialized areas that meet a specific need for our patients, and we can offer, state-of-the-art electronics, state-of-the-art free space, and all of the state-of-the-art vision therapy activities that a person would need to be successful in this type of a program.